The content in this episode is not meant to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your own physician or other qualified medical health providers for any questions you have on your own personal medical conditions. Hey guys, it's your girl Boonie, and you're listening to episode 138 of the Boonie Breakdown Podcast, your source for all things responsible and ratchet. All right, welcome to this week's episode, guys. I am really excited for this episode because, one, it is a super responsible episode, but it is so educational, and I hope it helps a lot of people out there kind of consider new paths as we talk about fertility. And so my guest this week is Lisa Hendrickson-Jack, and she is a fertility awareness educator, holistic reproductive health practitioner, and she has personally dealt with issues surrounding birth control, and she talks about fibroids, and we talk about menstrual cycles and being older and childless. I know a lot of my listeners are like me, where we're mid to late 30s with no children. And so this was a great conversation. We also even talked about different tools you can use for your period, right? Tampons, pads, and now we know cups. Those are gaining popularity. And so I know the fellas listening might be like, but I feel like you guys should listen to, because it might give you some insight on what the women in your life deal with on a monthly basis and when they're trying to conceive. So please stick around for that conversation. I want to hop right into our pick of the week. This episode is releasing, a day late just because of the holiday, Memorial Day weekend. But I will say this weekend was amazing for me because I had a chance back to back to actually socialize with my friends. And it made me realize how much I miss hanging out with them. We were very responsible at both. It was only 5 people there. We were socially distant. And it was great. Each time, both of them, I think I got there at like 4, left at midnight. 8 hours of socialization on 2 days was amazing. If you can hear it in my voice, I'm a little stuffy now because my allergies hate me. All that pollen is like, girl, what was you doing? But I feel so good. I feel so happy. It was nice to see my friends who I have not been able to see in person for so long. So I love it. If you are not anxious or, in a compromised health or immune system, and you want to figure out a way to safely go hang out with your friends, I wholeheartedly recommend it. It did a lot for my spirit. To do that twice this weekend. It is worth being stuffy and dealing with my allergies right now. So go do that if you have yet to do it. All right, housekeeping. There are 7 episodes left in season 7 of the Boonie Breakdown Podcast. That's right, there are only 7 more episodes. This season seemed like, I don't know, it seemed way longer for me. Is it just me because I was I don't know. It seemed a little longer than normal. But yes, we're starting to wind down. I have enjoyed this episode. So yes, mark your calendars. Monday, July 13th is the last new episode for season 7. And you guys really enjoyed the episode with Brian last week, episode 137. The ratchet is on pause. And I must say, I put in the Would You Rather this last week on Instagram. I did, one of my questions was, would you rather date Brian or would you rather fuck Brian? And it was so funny how many of you DM'd me saying, I'm not answering this, skipped. But a lot of women, 175 in particular, answered it, and it was overwhelmingly 67% said you'd rather fuck Brian, while the rest said date. So take that as you may. God bless y'all that said you were going to date him. Brian knows I kid. He knows I love him. Also, I want to shout out my Ratcheteer gang. You guys are awesome. Last week, we were charting on the U.S. charts for Apple Podcasts. We were charting on the Canadian charts for Apple Podcasts. And for the first time ever, we were charting in Trinidad and Tobago on 3 different charts in Trinidad and Tobago for Apple Podcast apps. So thank you, thank you, thank you guys, especially down. Hey, Trinidad. Thank you. It was very nice to see my podcast listed right under some heavy hitters like Oprah. I mean, to be in the top 3 of all podcasts, relationship podcasts in Trinidad and Tobago was amazing. So shout out to the Ratcheteer gang down there. When this is over, I might have to come visit. So yes, thank you again. And if you are new to this podcast, you can follow us on Apple Podcasts, Spotify, SoundCloud, Stitcher, Google Podcasts, iHeartRadio, any app that you listen to your podcast on. You can also follow us on social media at The Boonie Breakdown on Facebook and Instagram, and just at Boonie Breakdown on Twitter. We're very active on Instagram the most, but you can follow us there. Even if you want to follow us on Pinterest, I'm over there too, The Boonie Breakdown. Go ahead, look at my boards if you want to. And we are always, always thankful. We're so close. I think we need 12 more reviews to hit 100 5-star reviews in Apple Podcasts. So if you do listen in the Purple app and you love it and you haven't done it, you just go in there, search The Boonie Breakdown, even if you're already subscribed, click it, scroll down, it says write a review. You can just hit 5 stars and that's it. But if you really want to go above and beyond, get A+ gold stars, you can type a few words about how dope the podcast is and then hit submit. That's it. 5 steps for 5 stars. We're almost at 100. I appreciate all of you. And I read every single review that comes in there. So your review could be on the next episode. All right. And when sharing this episode, please be sure to tag us. If you put it in your Insta stories, I love seeing it there. And just be sure to use the hashtag The Boonie Breakdown and the hashtag PODIN, PODIN. So that is it for me, guys. Look, get a pen, a notepad. You're going to want to take some notes in this episode. It is so good, so responsible, so good. So that is it for me. Let's get ready to break it down. Hey guys, it's your girl Boonie, and I'm excited for this week's episode. As you already heard her wonderful bio, I just want to take the time right now to welcome Lisa to the podcast. Thank you for joining us.
Thank you for having me.
I think my audience might be a bit shocked by this topic, but when I thought about like focusing on fertility and holistic reproductive health, but when I thought about it, I'm like, my audience is primarily women over the ages of 30, and most are childless. But I know, even in my own circle, I know a lot of people who are 40, 38 who really want children and just aren't in that space where they're having them yet. And so I'm like, this is the perfect episode. So I hope people aren't too shocked and they get a lot of good information out of this. So first, can you just give us some background about how you got into this space and how you became a certified fertility awareness educator?
Yes, absolutely. In my case, I discovered fertility awareness at a really young age. So I was just out of high school, first year of university. I had been on the pill for period pain and heavy periods. So from my very first period, it was always painful and heavy. And I
Oh
didn't
wow.
really know what to do, right? Because I was like 14. And so uh, I went to the doctor with every intention of getting put on the pill, and I really didn't have to say much because before I even finished my sentence, he was already writing the prescription.
Oh wow.
And I mean, I was in sports, I did ballet, like nothing like bleeding in a leotard, right? So, what I noticed was that as soon as I started taking the pill, my air quotes periods, which I now know are withdrawal bleeds, not true menstruation, were a lot easier to manage. They were lighter. I didn't have as much pain, and I was able to kind of do what I needed to do. Um, but then I remember thinking to myself, like, wow, they're fixed. And so then I would go off of it thinking that it was fixed, and they would come back with a vengeance every time. So by the time I was then first year university, I just started a new relationship, needed to figure out how I was going to not get pregnant. Um, because I wasn't using it for actual birth control as a teen, as a young teen, I should say. I realized that, like, a couple of things. I didn't really want to be on the pill all the time. I didn't know about all the side effects that I was likely experiencing. In retrospect,
Mm,
I do remember feeling anxious and feeling depressed, but I didn't put that together until I was older. But I do remember having migraines and my breast being sore all the time. So there's a couple symptoms that I just didn't feel like I wanted to be on it. But also, I had witnessed women in my family who had had issues getting pregnant with fibroids and different challenges. And I had the sense that, like, okay, so I don't know what it's doing to me. I know it's not helping, like fixing anything, because every time I come off of it, my periods are just as bad as they were. And I kind of had this intuition that I was like, I don't know. Like, I feel like I shouldn't have periods that are so painful and horrible. And I really wanted to figure out what was going on and try to fix that naturally, I guess.
gotcha.
I probably wouldn't have articulated it in that way, but at the time that was on my mind. And also, because I wasn't taking it for birth control all those years, I wouldn't take it at the same time. So I remember thinking to myself, like, well, geez, I'm going to be stressed the whole time. If I ever miss a pill, I'm going to always be stressed that I think I could possibly be pregnant, because I really just didn't want to be pregnant. And so I remember thinking, okay, so I'm just going to use condoms all the time. And then I was like, but if I'm using condoms all the time, then what do I need this pill for? So all of this was going on around the time that I discovered fertility awareness. So
Gotcha.
I discovered that women aren't fertile every day and that you could identify the fertile window. So that, in combination with condoms, and I was off to the races, because now I had more information that would allow me to more effectively use condoms and understand, when in my cycle I could possibly get pregnant, as opposed to thinking I could get pregnant all the time.
Anytime, yeah. And I think it's a lot of misconceptions out there, and especially I even think about my own personal journey. Like, thankfully I don't have painful periods. I've had issues with birth control. We'll get into that a little later, but I just kind of felt like it was just like you were told, once you got your period, you can get pregnant,
Yeah.
and that was it. It was like, oh God, now I have to always be thinking about it. But it's really only what, like 5 or 6 days out of the month that you can really get pregnant. But we're gonna get into all this, so I'm gonna circle back to the one thing you mentioned about your cycle, and I feel like this is like a popular topic now, um, about what type of product you should be using with your period. I want to go very simple first. And so we have, like, for the longest time, being a black girl growing up, I could only use pads, because if you use tampons, then it meant you were fast. And then I was like, this sucks. I'm gonna figure out this tampon thing. I think I was like in college, and then I was like, okay, tampons, and I've been using tampons pretty much ever since. And now we have the cup,
Hmm.
and I can say that I have progressed there, because it freaks me out about um using it in public. But so yeah, so I'm gonna ask you,
Well, let's go there.
what do you
Um,
think? We're gonna start with a cup, because that's the one that freaks me out.
um, well, I just wanted to share that. So when I first got my period, I used pads also. And
Yeah.
I'm trying to think back, but I hated pads. I hated them because I hated feeling like I was wet all the time.
Yeah,
Um,
that diaper feeling,
yeah,
it's
yeah,
not fun.
I hated them. And the first time I used a tampon was really interesting, because it was like my grade 9 graduation party, and we went to a water park, and I had my period. And so I just remember, so my mom didn't have an issue with me using tampons. I think for that reason, I think it was more that she didn't use them. So she was kind of, like, you kind of
Gotcha.
teach what you do. But I remember, like, I bought the box of tampons. Of course, I bought OB without a applicator, right? Like, that's not the
I
best
feel
way
like
to start,
that's what it was, right?
and
That's why I was afraid of them. My mom had OBs without an applicator. I'm like, how do you put this
I
in?
know. And so I'm holding the thing, the thing that shows you how to put them. I'm holding it open. I've got, like, my leg on the counter, and I'm trying to figure out where to put this thing. And then I go to my mom, and I was like, "Mom," I was like, because I think I figured out where it goes, and I had no idea. Like, I had no idea, like, where it went. And I remember when I finally figured out where it went, and so, you put your finger in there, and then you try to get the tampon in there. I went to my mom. I'm like, "Mom," I'm like, "that's the vagina?" She's like, "Yeah." I'm like, is that where the penis goes? She's like, yeah. I was like, is that where babies come out of? Yeah. I was like 14 or 15 years old and I had no idea.
Yeah. And I laugh because I had a similar experience. I went to a predominantly white school for middle and high school, and it was a very interesting dynamic between the white and black girls with periods. And one of my friends had a pool party. I believe it was like seventh grade, and I didn't get in the water because I was on my period and I had a pad on. And then she's like, just put a tampon in. So she gives me one, and her mom buys me a bathing suit in the shop at the pool because I didn't even come in a bathing suit. And I'm in the bathroom like trying to figure out how to put this in, and I just couldn't figure it out. So I just came out, and I remember I had the pad in my bathing suit, but I would not get in the water. I just had like my legs dangling in the pool because I was like, I can't get in the water.
Yeah. Trust me. Well, I think that, everyone listening will probably have a nice chuckle about all that. But so, I mean, the first time I used the tampon, it wasn't comfortable. Like it was, but at least it was like half in. But at least I was able to go and have fun. That's what I really wanted to be able to do. I didn't want to miss out on this fun thing that all my friends were doing because of my period. But so I actually started using cups when I was around the same time. So it was like around that same first year of university. We had a women's center on campus. They would regularly bring in interesting speakers that would talk on feminist topics, which is how I discovered fertility awareness. And I remember I went to this, they had a workshop essentially. And I remember they had one of the speakers and it was really informal. So it was like in a
Mm.
room and there was like a bunch of women in there. And so the woman at the front, I remember she had a tampon and she put it in. So by then I was like an avid tampon user. I never went back to pads, but she had a tampon and she put it in a cup of water. So anyone can do this. If you got a tampon at home, do it. So, cup of water, tampon in the cup. And then she showed how it expanded and she's kind of like showing that this is how much water it can absorb. But any human that has used a tampon knows that it is impossible because the tampon would like because it's in your body, right? So
Yeah.
so they're basically arguing the point that it's not designed for what's actually going on in your body. Like we don't have blue liquid,
Mm.
nor is it water. We have blooded tissue and fluid. And when she pulled out the tampon out of the water, in the water was a swarm of fibers. And she was like, and that's what
Mm.
stays in your vagina. So, yeah. So then, and she talked about
Uh,
the rayon, and she talked about the bleach, and she talked about the dioxins, and she talked about, and since, there are women who get painful periods who stop using the non-organic pads and tampons that are bleached that have been found to contain dioxins and other chemicals and toxins. Because I mean, man, isn't that cotton so white, right? How does it get that
yeah.
way? And we're putting it in our vagina. You may as well put it in your mouth. Like your vagina absorbs like similar to your mouth.
Yeah, it's tissue, yeah.
So after that, after I saw that, and they also showed all these other menstrual products. Remember, they had sea sponges and they had cups, and by cups I mean cup because this was around the year 2000. There was like one company that made cups. My first cup was a keeper, and it's crazy because they're still out there. And then my second cup was the Diva cup. But back then there was like now there's like 100 different companies that make these cups, but back then there wasn't. So I started using my very first menstrual cup was the Keeper, and I've been using menstrual cups for like 20 years.
So I have a question because I feel like that's cutting edge. I just found out about the cups maybe in like the last 3 years or so, maybe 3, 5 years.
Yeah, I'm a vet.
Yeah. Okay. So now I have questions because that was gonna be my one question. Like, okay, for people who can't use the cup, are the organic tampons and pads at least better than the regular ones, which you've kind of answered already? So now
Absolutely.
the cup. Do you? This is like a practical usage question. So, as a user of the cup, do you have to take it out every time you go to the bathroom? So, like if you're in public, right? Do you carry an extra one that you take that one out, put the other one in, and then you go clean the other one and put that one away? Like, how does it logistically work?
Oh, I love
I
these
think
questions.
that's where my mind gets stuck when I think about the cup.
Yes, I love these questions. No. So when you have the cup in,
Okay.
so I mean, over the years, like, and there's different sizes, there's different types, like there's so many different things, but provided that you have the right cup that fits comfortably. When you go to the bathroom, so let's say you just go and you take a pee, so you urinate, the cup doesn't come out.
Okay.
Like, the cups are pretty big. I remember the first time I saw this cup, I was like, "Where is that supposed to go? Like, are are you kidding me?" Right? Because it's not a tampon. It's bigger than a tampon. But you fold it in half and you fold it in half. So that's there's two kind of main folding techniques that I'm aware of. One is, so you it's like a cup, so you fold it, squash it, and then you squash it again. And so then the base of it is small, kind of like the size of a tampon, and then you insert it into your vagina. What's different about cups is that there's no applicator. So you have
Mm,
to have some degree of comfort with your body to be able to, basically you have to push it in with your fingers. And then what happens is the cup opens, or you have to kind of twirl the base of the cup. So you have your fingers in there,
okay.
and then it opens. So it kind of fills with air, pops open, and then once you twirl it, it kind of forms a suction. So none of this hurts. It's not, but it actually forms a bit of a seal. And then once it's in there, once it's in right, then you
It's
don't
in.
feel it. Yeah. The challenge is that there is a learning curve. So when I first started using cups, it took me like 3 cycles. And keep in mind that I was like 18 and there was no YouTube, so there was like nothing. It was just me and the cup. Like,
You're
that's it.
brave. You're
So
brave
I just had to
because
figure it out. And so I had to use it and twist it and mess with it until it felt like, until I couldn't feel it anymore. So, initially I wasn't pushing it high enough and whatever, but now there's a million YouTube tutorials. There's all these women who, like, so even if you don't get it, you will, and you'll get it faster than I did, because you there's all this help that I didn't have. But yeah, so essentially, when it's in place, you don't feel it. It seems weird that you don't feel it because, like I said, it's bigger than a tampon, and like, you kind of like,
so
wow.
is it like a soft like plastic or
So there's different kinds. There
okay.
there's ranges. Some of the cups are very soft, very malleable. Some of the cups are firmer. So we're now at the point where it's like anything you want is available, and which presents certain challenges, because you may want to try a couple to figure out what is actually going to work for you. Right. So that's kind of,
Okay.
so for me, I started, like I mentioned, with the Keeper and the Diva Cup, and now I use, and I'm not affiliated with anybody, but now I use the Maluna Cup. And I like that option because they have different, you can choose the size, like tall or short. You can choose
Oh,
the
okay. I didn't even know they had sizes.
firmness. Yeah, and then bigger or smaller, and then you can choose the firmness, like softer. And I also recently have started using the Intimina cups, so I have like multiple cups. And what's interesting about the Intimina cups is that they're all very malleable. So they're not really firm, but they do form a really good suction, and they have different sizes and different shapes and things like that. So um yeah,
So
like,
it's kind of like, I guess the equivalent here would be, all the natural hair girls who are product junkies and you try different shampoos and conditioner.
yeah.
So I didn't even know that it was different sizes or material. Like I just learned something new. I just always see it next to the tampons and I'm like, "Oh my god, I just my mind just can't even wrap my head around it."
Well, let me share a couple of the reasons why like what appealed to me, because it appeals to everybody for different reasons. So it appealed to me because when they showed me that demonstration, that really stuck with me. And when they showed the cup, I mean, the cup is designed to just collect what you have. I felt like the cup was
Okay.
designed for, like, by women for women, because the cup, if you have a clot or if you have some tissue, like,
Oh,
a
that's a good
tampon doesn't go in, like,
point.
yeah, so it actually collects what you have. And also, I remember them, so my periods were always on the heavier side. I mean, they've certainly settled down now that I've cleaned a lot of stuff up from when I was in my early 20s, but my periods were super heavy all the time. And so I got to a point where I was changing my tampon every 2 hours. I also have
Wow.
fibroids, which were detected when I was younger. And of course, I had to demand that request because I had fibroids in my family. Because also, as a Black woman, it's
Yeah.
in the family. Half of my cousins, I know so many women had to have hysterectomies, including family members and all that. So, um, So yeah, my periods were super, super heavy. Like I had to wear the tampon, I had to wear a panty liner, and I had to change it every 2 hours at one point. And so when I started using the cup, it was like, oh wow, like at least I don't have to change every 2 hours anymore. Like there were times when I could wear it for half the day or throughout
Oh,
the whole day.
wow.
Yeah. And especially if you're active, then it gives you,
Something to consider. I
yeah.
think what just sold me possibly, the things that, people don't talk about, the blood clots, right? You pass a clot. I mean, it's not a bad thing for most people, but I hate that when you pull it's sitting on top of the tampon.
Yeah, the tampon was
And
meant
it
to absorb blue liquid.
yeah. Ah! It's all connecting. Okay, I might give it a try. I might go buy well, I'm going to give it a try. I'm going to go buy one um and since we're all home right now,
Well, yeah.
I feel like this is a good time to try.
Okay, but I want to tell you something because I know this is like one of the questions that terrorizes anyone who's never used it, right? Like, what do you do if you're like in the mall and you have to change your cup, right?
Yeah, I always think that. Like,
So I'll just share, like, everyone does it differently. There's different ways to do it. So I'll share what I do and then I'll share what other women do because I mean it's a concern. But for me, because my periods were on the heavier side, I never had the option to like wait until I went home from work. I on my
mm,
heavier days, I actually would have to change midway through the day. So in a public bathroom or at home, like it's ideally when you have a single stall, when you have like a door and just
oh yes.
yourself. So, go into the bathroom, what I do, and I'm not saying this is the right thing, I'm just saying what I do. I wash my hands first and then I would usually grab like a paper towel or something like that, and then I go into the stall if it's a stall, or it's you don't really have to worry about that if you're by yourself. And then I would remove the tampon or remove the cup and then, dump the blood into the toilet. If I'm in a stall by myself, like it's just me, one toilet and a
Oh,
sink,
then you can
then
wash
you
it.
just
You can
rinse it
rinse it.
out, yeah, and then you put it back in. And then if I'm in a stall, so what I do now is because I've, like I said, 2 decades, I'm over it. So I'll just kind of hold the paper towel, whatever, and then I just dump it and I put it back in. But a lot of women will bring in like a water bottle and rinse it out. But like I said, 20 years, I'm over
Mm,
it. I'm not afraid of all the stuff.
you're like I'm a pro.
But you can
Okay.
just, take a water bottle in, rinse it out, and then put it back in, and you're good to go. And then you
Okay.
just wash your hands again. Yeah, so it's like and then some women, especially on the days that aren't heavy, you can just wear that thing all day, so you don't necessarily have to worry about changing. Because you can wear it for 12 hours. You don't have to change it.
That blows my mind because it's such a change to the normal
Yeah.
practice you've done. Like what? I've been doing this 20 I've had a period 20 something years now, and so it's like every 4 hours this you have to go change, but to
But
say
it's
you can go for
not absorbent, right? So it's
yeah.
not collecting bacteria. I mean, you can't leave it in for days, but at the same time, like,
Yeah.
you can leave it in for 12 hours. Like, you can
That's a win.
yeah.
That's a big win. So I kind of want to pivot now before, we try to get as much in and then people can connect with you on their own. Birth control. You'd mentioned that in your personal story. And I too had a story with birth control. I don't have heavy or crazy insane period. I mean, well, I have a heavy day, but I don't get cramps. I've only had cramps like once in my life. So I have a pretty easy period. It can be long, like 6 days sometimes, but I'll take that over cramps. And I tried going on because sexually active, don't want to have a baby. I was on birth control. The pills, my body hates the pills. Like I've tried low dosage, like every pill that has come out, I probably tried. My body hates it. And then I switched to Depo, which I had no adverse reactions versus except weight gain, which kind of sucked. So then I just now I'm not on any birth control. I just use condoms for birth control. And so with your story and the knowledge that you've gained in your career, like how long would you suggest that women stay on birth control?
Um, well, that's I would say that with birth control, I've got a few issues with birth control, but my biggest issue with birth control is the lack of informed consent. I It's a
Okay.
really big problem that birth control is not um like I'll give an example, I'll give an analogy. Like when you eat a banana, you don't need to worry about possibly increasing your risk of like liver cancer and cervical cancer and breast cancer. And it
Mm.
certainly isn't associated with like loss of libido and depression and anxiety. So but somehow in our culture, we really don't even think of the pill as medication. And like 100
Mm.
million women worldwide are on it, and when women are put on it, I've really met like two women in life, maybe one, who's ever told me that their doctor opened like, okay, I want to go on the pill. Okay, let me open up the insert and go through all of the side effects with you. And if you start to experience panic attacks, if you start to feel anxious, if you start to feel depressed, if you start to have intrusive thoughts or paranoid thoughts, if you start to have recurrent yeast infections, if you start to
Mm.
feel like you don't have a libido anymore, if sex becomes painful, if you notice that um, you have headaches, or pain, chest pain, or like if someone actually goes through this, come back to me, because we do know that there are side effects associated with it. A lot of women don't necessarily experience these things, but also a lot of women wouldn't even know that it could be related, so they wouldn't
Yeah.
necessarily make the connection. So that's one of my main concerns with it, because a lot of women do have side effects but don't know it could be related. If nobody tells you that panic attacks and anxiety and depression could be related to birth control, then especially if you go on birth control and you don't get those side effects right away, like if you start developing those side effects like 3 or 4 years in, which is actually quite common, then by 3 or 4 years in, you just think it's you, because you would never
Yeah.
think that, like, after you've been taking something for like 5 years, you
Why
would
would things
never.
switch up now?
Yeah.
Yeah.
So a lot of women end up having like these panic attacks, and these like, all this stuff starts to happen to them. And like on a desperate night of like searching online, then they find like, oh, it could be related to the pill. And then they go off of it, and then eventually their symptoms subside. So that's my biggest issue with it. And also, I've recently interviewed a number of women who actually had the severe adverse effects, like
Mm.
pulmonary embolisms, stroke. And again,
Oh gosh, that's so scary.
it is. And the thing about it is that, so if I smoke cigarettes, like cigarettes are also have like a black label warning, because we know that it can kill you. And so, but the thing about cigarettes is like, when I buy, like, I don't smoke, but if I were to buy a box of cigarettes, like in Canada, on the box are pictures of people with like mouth cancer and like black lungs. So like, you can't be like, I didn't know.
Yeah,
But
wow.
if you go on the pill, like the doctor, the women that I've spoken to, and pretty much all the women I've ever encountered in my entire life, no one ever told them, look, if you start to get headaches, severe headaches, migraines with aura while you're taking this, you need to come back to me, because if you have headaches while you're on this, you could be at an increased risk for blood clots and stroke. We know that it's relatively rare, but it does happen because it kills hundreds of women every year. So at least if you have these symptoms, come to me. So that's like my PSA for the day. I mean, I'm not trying to say no one should ever use birth control. What I'm trying to say is that as women, it's a medication, and there are side effects ranging from mild, moderate to severe. And really and truly, we should be informed. So that's the first thing.
Gotcha. I would agree with that. And I think too, like when I decided to make the decision to go off of birth control, I was just researching, and I'm hoping that you can clarify this because I'm probably not getting it. I'm not going to say the statistic, but one of the things I read, it was talking about messing birth control having an adverse reaction to your sex drive and your sex life. And one of the things I read that always stuck with me was that it said some women said that birth being on birth control shrunk the physical size of their clitoris.
Yes.
And for me, I'm like the part of your anatomy that gives you the most pleasure, right? It's literally physically shrinking that. And I think that was like my final straw, honestly. Like, nope, I can risk some things, but I can't risk that.
Well, there
So is that is that true? Because I know this was years ago. I looked this up, but I just want to bring that up.
Well, it's funny that you mention it. So there's a study that was done where they took a small group of women and put them all on the pill and measured the clitoral volume, and also the the volume of the vulvar tissues, so
Okay.
the tissues around the vulva, like the vaginal opening and those types of things, and the labia. And in that particular study, so again, it was small, but all of the participants experienced a decrease in the volume of the clitoris. So it shrunk all their clits, and the average shrinkage was 20%. Now, I've had people tell me, well, that was a small sample size. It's not statistically significant, blah, blah, blah. You know what? If you do a study and all of the women in the study have clitoral shrinkage when they use the pill,
Then
then the
yeah.
question isn't like, oh, don't shoot the messenger here. The study was actually done, and you can tell me that it wasn't statistically significant. Like, I love when people say your science isn't good enough, but at the end of the day, like, that would seem to me an appropriate stepping stone for further research. So the real question is, where's the study that measures the 1,000 women? Where's that study? You know, that
Mm.
so we should, because if you're telling me that it's not statistically significant or whatever, I mean, that's pretty significant. So there's a number of studies that have been done on the effect of birth control on sexual function. And so there are studies that show that it does shrink the clitoris. There are studies that show that it thins the vulvar tissues, so thinning, for example, the tissue around the vaginal opening. So there are also studies showing that women who use birth control are at a greater risk for experiencing painful sex. So, I mean,
Mm.
there are women, so although it's not like the vast majority, right? But there is a percentage of women who take birth control and who start to experience painful sex. And one of the most common ways that that's experienced is pain on penetration because of because of the thinness around the vaginal opening. And
Wow. Wow.
And those are the physical side effects. So there's a number of studies that have looked at sexual function. So look at libido, look at sensation, intensity of orgasm, ability to orgasm. And so many women report that when they're on birth control, they lose some degree of their sexual function. They don't want to have sex anymore. There's actually a running joke that the reason that birth control works is because you don't want to have sex anymore. Um,
Oh.
yeah, and also there are women who then have reduced sensation, or they notice that it's more difficult for them to achieve orgasm. So, um, I mean, and that's one of the reasons why a lot of women don't stay on birth control. But my question then is for the 14-year-old girl who doesn't even hadn't hasn't even had an experience of her full sexuality. How would she even know that her libido's? How would she even
That
know that,
part.
like, maybe she
Yes.
just thinks, oh, there's something wrong with me, I can't orgasm. How would she even know? She never even had
Yes.
opportunity to experience her sexuality in full.
Yeah, that's so upsetting. Because I remember when I read it, I was like, okay, of all the things I was going through, and when I saw that part, I was like, oh, okay, yeah, no, we're gonna make the choice to go off of this. And I remember the conversation with my doctor. I ended up changing gynecologists because I'm like, you also did not realize that in this time frame that I've been on this, some of the symptoms I was having, my blood pressure was damn near like when I was on the pill, my blood pressure was like damn near stroke level. But none of this stuff you noticed. And I was coming and complaining and saying I'm having headaches and this. And it was just like, oh, just keep taking it. It's fine. We'll switch you to a low dose. And it it didn't go away.
Yeah.
So I remember I was just so upset, like she's not listening to me. So I switched to a different gynecologist, and she was like, "Oh my god, you need to immediately get off this pill." Like, I think my blood pressure was like it was like 180 over. I mean, it was something insanely high.
Jeez, that's super high.
Yeah.
And the headaches. But see, this is what I mean. And there's something to be said. I mean, when you talk about stuff like this, it can really come across like we're slamming doctors, but it's often not necessarily the fault of the individual doctor. It's the fault of the system that trained the
Mhm.
doctor, because doctors are the way, from my understanding, and this comes from interviewing a number of doctors. So I interviewed a number of doctors for the podcast and for the book and all of that. And, I asked questions around what is it, what are you learning in med school? And what did you learn about birth control specifically? Like, how did you learn about these risks? And so the risks about, the emotional risks, depression and anxiety and stuff like that, those are often minimized, not discussed, or and that's why a lot of
Mm.
women feel like they're being gaslighted, because they're not life threatening. So it's kind of like you're just complaining. And unfortunately, that is kind of how it's presented. It's kind of presented
Yeah.
as this annoying barrier that doctors have to overcome. Like, oh, how do I get these women on the pill? I mean, without discourage, like, so there's that aspect of it. But then when it comes to the life-threatening side effects, it's presented in a very specific way. Like women who are 35 and older who smoke or who are overweight have a greater risk. So doctors are kind of primed to really look for women in those risk categories. So if you're 20 and you're skinny and you don't smoke, they're not really thinking that you have any risk of having a stroke. Because that's not how they're
Wow.
taught. And so this could be an amazing opportunity to address the way that doctors are trained. Because ultimately, if doctors were trained in medical school that all women are at risk of stroke and these side effects, and all patients need to be counseled by law about these risks and told that if they ever experience a headache, dizziness, et cetera, that they need to come in immediately. If that was a standard, women, a lot of women wouldn't be dying. I mean, that's a huge,
Yeah.
huge problem.
Yeah, I totally agree. And I think too it's so hard. I think it's one of the biggest lessons that women actually have to learn is advocating for themselves. And you wouldn't think that you would have to advocate with your medical professional, but sometimes I feel like that's where I advocate for myself the most. Um because I definitely was just like, I'm gonna listen to my body. Something's not right here. And I'm gonna go get a second opinion. And so I was glad I did because as soon as I went in with a fresh set of eyes, and she didn't say anything negative about my old doctor. It was just like, oh my God, like, no, we're gonna stop this now. Like, stop taking it.
Well, I just gotta say that, I mean, my experience is a bit different. Like my experience says that that's exactly what you said. That's where women often have to advocate for themselves the most. I would
Yeah.
second that, and it is really unfortunate, but it's the truth. And I
Yeah.
think that you're amazing, and you're not necessarily the norm. You had these symptoms, and you trusted your intuition, even though your doctor didn't really take them that seriously. You basically fired your doctor and found another one who would listen to you. A lot of women, when the doctor kind of dismisses their symptoms and things like that, don't have the wherewithal to trust their intuition. I mean, we're taught to listen to our medical professionals. We're kind of taught that they know
Yeah.
everything, that they know, like they went to medical school, and so they must know more than me. Well, no, no one knows more about your own body and your own experience than you. It doesn't matter. The doctor could be in medical school for 40 years. They'll never know as much about your body as you. So what you did is so important, and everyone needs to hear that. You just listen to your own self above what the doctor said.
Oh, thank you. Listen to yourselves, ladies. I just want to pivot one more time before we wrap up. And a good amount of my audience, myself included, are over the age of 35. And even when I look in my friend circle, not me per se, I'm not, I don't know if I want children or not. So I'm not kind of pressed about it. But I've been having, I have my new gynecologist. She's forward thinking, and um, she was trying to encourage me to do fertility testing because she's like, you're 35, you've never been pregnant. Not, I know you don't know, but you don't want to wait till you get to the point where you do, if you decide, yes, I do want children, that now you don't know if you can, you don't know what's going on. So she's trying to encourage me to be proactive. And I just feel like so many women who are, and I'm doing older in air quotes because I don't want anyone to beat me up, but who are older and who don't have children but want children. Is that something that you two would encourage them to do, to start looking at their fertility odds?
Well, that's a really interesting question. I just have to say that I find it to be super interesting that your doctor's kind of like, you're this old, you've never been pregnant. And it's a theme that we should just be aware of. This idea that if you're not on birth control, it's either birth control or pregnant. When I was young, it wasn't like that. Like, it wasn't like that when I was growing up. Condoms were taught to be an effective method of birth control. But I just want to point that out, that one of the possible reasons that your doctor could be saying those things is because she knows that you're not on birth control. and it's kind of like,
Mm.
wow, this is weird. You've never been pregnant because birth control, not being on birth control is considered to be the same as being pregnant. And so she's kind of like, oh, there must be something wrong because you've never gotten pregnant. So I just want to call that out as a
Ah,
possible
that's a I
BS.
didn't even think about that. Yeah,
I
because
call BS on that.
and I laugh because she definitely it's like, "Are you sexually active?" I'm like, "Yes." She's like, "And you're not on birth control, all right."
Yeah. Yeah. And so I've actually, because so just to give an example, because I mean, fertility awareness, that's what I do, that's what I teach, and that's what I practice personally as well. And so I've worked with so many women over the years whose doctors can't understand what's going on. And I've also worked with women over the years who they okay, so you use, let's say you use fertility awareness. So it's basically you track your cycle, you identify the short window of fertility every, every cycle, and you
Okay.
don't have unprotected sex on those days. And let's say you do that for like 3 years. And you never get pregnant because you can't get pregnant if you don't have sex on the days where you can possibly get pregnant. And I've had women who basically are wondering if they're sterile because their
Oh,
doctors keep saying things like,
wow.
oh, well, this is really weird. You haven't been pregnant. And like, let's say, and I've also, I did a podcast where I talked about the reasons why the method fails, because sometimes women will use the method correctly for like a year and they don't
Okay.
get pregnant, and they actually start to wonder if they're not fertile. And then they'll like, like have sex on a questionable day, meaning a fertile day, and then they get pregnant. But it's like they were testing the waters because they really didn't like, they still didn't trust it even though the method was working.
And so that's the thing. I'm gonna like I had to do better with that myself because I'm like, okay, I was like just tracking my period. Like I used to just only use my period app to track my period. Like, okay, what day is it coming? All right, that's all I cared. And so now, like, I'm like, okay, pay attention to those green days.
Well,
They
yes.
mean something too.
Well, pay attention to your mucus. I think that
Yeah.
your body's the best indicator, and apps should always come secondary. But I just wanted to point that out because I find that kind of idea, because you are using protection and condoms do work. I mean, I understand that there's a failure rate to all methods of birth control, but condoms are 98% effective when used correctly. And yeah, so there's that. In terms of your actual question around, as we get older, should we be paying attention to our fertility and what should that look like? I do have an opinion about that. And one of the things I think is really important as we get older for us to think about as women is that I think it's really important to start questioning your choice of birth control method as you get older.
Okay.
A lot of women, you're 16, 18, 21, and you go on birth control because that's the best option for you at the time based on the information that you have, right? I mean, if you're 21 in the middle of
Yeah.
college, it's not a good time to get pregnant. And so the thing is that often as we get into our like mid to late 20s, early 30s, we may still be operating from a decision that we made 10 years ago, but we're not
Mm,
necessarily the same. So a lot of women actually abruptly realize that in one way, shape, or form, where there would have been a time when a pregnancy would have been totally catastrophic and it would have been the end of the world. But maybe now that you're 10 years older, it's not exactly the same thing that it would have been. And
yeah.
we've never really reevaluated that. You made that decision 10 years ago and you're still operating under the same premise. So, in addition to the fact that we're not taught about our bodies and we're not taught that we're not fertile every day and we're not taught about, alternative methods to prevent pregnancy, it's really just hormones are heavily, heavily pushed much more now, even than when I was growing up. We're not taught about how our fertility changes with age. And we're not taught that when you come off of birth control, there's a temporary period of subfertility. We're not taught that. Even the
Mm,
doctors often say, oh, if you get pregnant, if you come off the pill, remember, being off the pill is the same as being pregnant, right? Let's freak everybody out. So you basically, all these women are essentially told indirectly that the second they come off birth control, they will be pregnant. And that's not necessarily true.
mm,
Some women, yes, some women resume their cycles and certainly get pregnant right away. But on average, it takes a minimum, or on average, it takes twice as long for a woman to get pregnant coming off the pill versus stopping using condoms. And with this depot shot, for example, it was an average of 18 months. to pregnancy after stopping the depot shot
Oh, wow.
versus 4 months with using condoms. So this is a very real challenge. When women decide that they're ready to get pregnant, they're ready to get pregnant. And when I say that, I mean this month. And because we've all been taught that pregnancy can happen all the time and being off the pills the same as being pregnant, then you're cool the first month, but the second month you're not cool, the third month, the fourth month. By the time you get to the sixth
Uh,
month or the 12th month, you're losing your crap already. You're at the doctor's office getting all kinds of shots to make you ovulate and all kinds of stuff. And you didn't even know that maybe your body just needed a period of 12 to 18 months post pill to just recover. You didn't know that because no one ever told you. And the research tells us that's what we need. So, to summarize this, what I'm saying for women as we get older is when we get to be in our late 20s, early 30s, if you want to have kids in the future, even if it's not right away, you want to start considering your birth control method. Like, it doesn't mean I don't believe that there's one birth control method for everybody. I think it's wonderful that we have all these options, but you might want to start considering a non-hormonal method. You might want to start considering like if even if a copper IUD can work with you, there's pros and cons for every birth control method,
everything.
let me tell you. But copper IUD is non-hormonal. If you don't have heavy painful periods, it can be a good option depending on the situation. I've done a couple episodes about that on my podcast, but it's important to just, I feel like we need to be more intentional. You can't just make a decision when you're 21 and think that that's going to be the same decision that's going to work for you when you're 35. At some point, we got to reevaluate. And if you want to have children in the future, it's a good idea to get off the pill or other hormonal contraceptives a minimum of, I suggest, 18 months to 2 years before you're ready to start trying, just in
Oh,
case. Just
wow.
in case, because some women come off the pill and they get their period right away. Other women come off the pill and it takes them 6 months. So you don't know where
Yeah.
you're going to be. And it's a good idea just to let your body just breathe and sort itself out well before you've got that pressure of trying.
I like that because I've never heard that advice ever, and it makes it makes so much sense just to let your body kind of settle back down into some level and not normalcy with air quotes before you embark on a pregnancy journey. And I think people listening to this, I was sitting here with my mouth open a bit, like shit, never even thought of that,
Well, and
like never even thought of that.
the caveat to that is that yes, it can take your body some time, but at the same time, pregnancy is possible any cycle with ovulation. So what I'm suggesting is considering coming off birth control while you're actively avoiding. So that means you have to have a plan and a strategy. But just remember a couple of things. Like, I'm coming from a different perspective here. I haven't been on hormonal contraceptives for my entire adult life. I've never had any unplanned pregnancy. So I want to just tell women, like, okay, look, being off the pill does not mean you're pregnant. Those two things are not the same. That's a lie that I don't know where that started, but that's something that would be really helpful if I was a manufacturer of hormonal birth control, because it would really keep a lot of women on it and I would make a lot more money.
That's
Okay,
true. And
so
I think
but
too
it's
the
not
other
the truth. A lot of women aren't on birth control and they're not necessarily pregnant. And also, you and I both know many women who have very complicated jobs, do all kinds of
Mhm.
complicated things all day. You can figure this out.
And that's the thing too. I think the other before we wrap up, I think the other thing that I really hate around the conversation around fertility is that the burden that it places on women, right? And so, yeah, we're doing all of these things, but I hate like it's not a pointing fingers, but it might not be you. It could be something your partner is experiencing too. And I just feel like women take the brunt of the infertility or fertility work that is needed to conceive.
Well, there's a woman whose work I love named Laura Owen who calls it reproductive labor. And she talks about
Mm.
how women are expected to just bear the brunt of this reproductive labor. So I just want to share along those lines a different perspective. So because I've never been on hormonal contraceptive in an sexual relationship with a partner, so there was never this. I've never been with a partner who could take for granted that they could, have sex with me on any day and just be able to ejaculate inside of my body. Like, we're just putting it out there, because
Mm.
on any day, right? It was never, that could never be taken for granted because I wasn't on anything. So because I was charting my cycles, I would, take careful track of my cycles and identify my fertile window. So any unprotected sex was explicitly planned. And so that means that all of my partners over the years had to participate.
Yeah.
And it meant,
They're invested.
well, it might sound like it's complicated, but it's not. I think that
Yeah.
we're at a point where, as women, not every woman doesn't necessarily have the agency. Some women are in not so nice relationships and all of that, but I think the vast majority of us have the ability to negotiate. And I think that we should give men some credit. I think that a lot of men are totally willing and happy to step up. There are a lot of men who do it already.
I definitely have been in relationships, situationships, or whatever, where where a guy has told me your period's late, and I'm like, what?
Tracking it. Some of these guys will like track your
Yeah.
period in their own period tracker on their phone.
And I go open my app like, oh shit, it is like 2 days late, right? But just one of those things. They end up coming that night, but I just laughed so much because he was like, your period's
Yeah.
like you trying to have sex, you should be on your period.
Yeah. Well, I mean, if what we want is equality, and I think also we shouldn't underestimate men. If anything, the work
Hmm.
that I've done has really made me to appreciate men more, because the vast, vast, vast majority of my clients, their partners are really supportive. Some of their partners are the ones encouraging them to do this because they're concerned about their health. Maybe they learned about the side effects, or maybe they saw it for themselves. I mean, I know of many women who went on birth control, and it's not that common, but a certain percentage of women have pretty significant emotional effects right away, and their partners are kind of like, you need to get off of that, we need to figure this out. So um, I think it's just helpful to hear a different perspective. There is not only one way to manage fertility. It is possible to manage your fertility without birth control. And within that conversation, it's important to note that hormonal contraceptives are not 100% effective either. There are women who
Mm,
use hormonal contraceptives and IUDs and who get pregnant. And so, we shouldn't just be even having the conversation, pretending as though hormonal contraceptive is 100% effective, right? Because nothing's 100% effective.
yeah. Well, I think this is the perfect spot to end. And this is the part where we do the breakdown. And I'm going to say one word, and you say the first thing that comes to mind. It could be a sound, a phrase, a noise, whatever.
Okay.
Okay? All right. The first word is mental health.
I don't want to say the first word that came to mind. Let me just say fresh air.
Okay. Birth control.
Choice.
Sex.
Mmm.
Diet.
Ugh.
Pregnancy.
Love.
Ovulation.
Power.
And last one, IUD.
Ouch.
I've heard pretty painful stories about insertions, so I've always been scared to do an
Me
IUD.
too.
Uh,
I was like, I don't think
I
it's supposed to go in there.
yeah, I'm like, nope, I'll skip out on that one. So thank you so much for doing the podcast. If you could just tell everyone where they can find you on the internet, on social media, the name of your podcast, and I will be sure to link all of this in the show notes.
All right. Well, thank you again for having me. This was so much fun. Um, for those of you who are interested in learning more about fertility awareness and all the great things that we talked about today, I've got tons of information in the book, The Fifth Vital Sign. It's available on Amazon in paperback, ebook, and audio formats. And you can get the first chapter for free over at thefifthvitalsignbook.com. And if you love podcasts and you want to learn more about fertility awareness, you can just type in Fertility Friday in your favorite podcast player and you will find me. And I've got a ton of freebies, free video courses, things like that over at fertilityfriday.com/freebies. I've got an introduction to fertility awareness course on there for free, and also timing sex for pregnancy video course. So lots of good goodies over there.
Awesome. So I will be sure to link all of that in the show notes. Be sure to listen to the podcast. Look, there are a ton of episodes over there. Very highly they're very, what's the word I'm looking for? Like they go very in the detail. So if it's a
Yeah, in the
specific
weeds.
topic that you are looking for,
We're in the weeds over here.
Lisa has you covered. Okay, they are there. So because I went down a rabbit hole and I was listening to like 4 of them, and I was like, oh my god, this is so informative. So be sure to check out her podcast. And Lisa, thank you so much for doing
Oh,
this.
it was so much fun. It was so nice to meet you. Thank you for having me.
All right, guys, that is it for this week's episode. I really hope you enjoyed and you learned some new things from our guest, Lisa Hendrickson-Jack. I'm telling you, she has so many topics over on her website. So if you wanted to dig deeper into something, do it. And we recorded this episode a while ago, so it reminded me I need to go get a menstrual cup because I am going to try it while we are still social distancing and quarantining at home. And if you enjoyed this episode, I encourage you to listen and subscribe to the podcast on Apple Podcasts, Spotify, SoundCloud, Stitcher, Google Podcasts, iHeartRadio, or any app that you listen to podcasts on. Don't forget to leave those reviews too. You can hear your review on the next episode. Follow us on all social media. Share the episode with those you love, those you don't love, those you fucking hate. I don't make these pretty images for nothing, okay? Have a dope ass week. Stay healthy, stay safe, stay sane. Thank you for listening. And remember, the ratchet in me always honors the ratchet in you. Until next time.